Welcome back. You've heard so many times that early detection is key in fighting cancer, and new technology is giving doctors more weapons in the fight against prostate cancer. And today we're pleased to welcome Dr. George Privet, Medical Director of Lexington Diagnostic Center and Open MRI, with a look at some of the latest screening options. Thank you so much for being with us.
Thank you for having us, Christy.
Now, some of this new technology, we were talking a little bit earlier in the break, it can be used multiple ways in an approach to prostate cancer. Tell us about some of the things that you're using to detect it.
Well, up until now, we've had basically the PSA and the digital rectal exam as screening tests for looking for prostate cancer. We've been able to do an MRI of the prostate in the past, but we couldn't make much of it. It just didn't make much sense. But there's a new software out now that uses a computer-aided diagnosis to help us to pick out cancers where they are in the prostate and to help guide urologists into being able to pinpoint where they might be trying to do the biopsy.
And what benefit does this offer patients and their physicians as they approach treatment and diagnosis?
Well, it gives it helps the urologist, as I said, know where to aim for when doing a biopsy. Also, 80% of men who have a biopsy, who have an elevated PSA, the biopsy is negative in 80% of them. And so it's very important then to know, well, is it not cancer there, or is it cancer? Did we just miss it on the biopsies? And this will show the tumors where they are and give, if they're there, and give the urologist another chance. Or if there's no tumors there, then it can put the patient's mind at ease.
Now, kind of walk us through the process a little bit, what a patient would go through if they had this kind of screening.
Sure. It's an MRI, and if you've ever had an MRI of your low back, it's sort of like that. You would lay down on a table, slide feet first into the to the scanner. An intravenous access line would be placed in your arm. And you would be given an injection of dye, and the scanner would do its thing. And then it's about a 30-minute process to get done, and then the computer starts to work on the images and gives us these advanced diagnostic images. They're colored so that you can see a red image looks bad and is suspicious for cancer, and a blue color over the area is normal.
Now, you mentioned earlier some of the other screenings may offer different results, and just overall, what is the benefit? Why is it so important for patients to maybe take an extra step like this to get a better picture of what's going on?
Well, I think all the information you can get about prostate cancer is good. The digital rectal exam can be normal, and you can have a cancer. And a prostate PSA can be elevated and you not have cancer. It can be normal and you have cancer. So it's another way to screen for prostate lesions, or to try to find them when there's a suspicion, a strong family history, an elevated PSA, or an abnormal digital exam.
Well, thank you so much for taking the time to share this information and look at this new technology. You see there on the bottom of your screen the website and phone number for the Lexington Diagnostic Center if you're interested in contacting them about learning more. Thank you for being with us.
Thank you so much for having me.
We will be right back with a check of your forecast. Meteorologist Mary Watson is out live on a sunny but cool day downtown for the opening and dedication of the Lyric Theater.
Well, Christy, it was a bit chilly outside, so we moved it inside because I also wanted to see what the Lyric Theater was all about indoors. And we'll talk about that forecast and also what you can expect this weekend here at the Lyric Theater coming up.